Today I'm going to be doing my partial and complete bed bath scale. I would first start by verifying my doctor's orders. Once I did that, I would perform hand hygiene before I went into my patient's room, closing the door to ensure privacy. Hi, my name is Sierra. I'm going to be your nurse today. Can you tell me your first and last name and your date of birth?
Hannah Martinez, 1226.
Everything is verified. Okay, Ms. Martinez, do you have any allergies that you're aware of, specifically to lotions, latex, or any soaps?
No.
Okay, we're going to be doing a bed bath today. Do you have any questions before we get started?
No.
Do you need to use the bathroom at all?
No.
Okay, so we're going to start. I would assess my patient's ability to tolerate the bed bath. That's like their range of motion, their pain level, if there was any incisions, make sure there's no drainage, assessing the skin for any lesions, abrasions, or redness and tenderness and swelling. I would then raise my patient's bed to a working level, comfortable working level for me, raising the head of the bed to about 45-degree angle. Once I've done that, I would de-gown my patient, starting with the unaffected side. Once I get to the affected side, I would remove the bag, run it through the gown, put it back up on the pole at this, resuming the same infusion rate. I am going to don gloves. Actually, I would don gloves before I change my patient just because I wouldn't know if there was any abrasions or any open wounds, so there's that. I would fill the bedpan up to 2/3 of the way, asking my patient to check it to make sure it's tolerable. It's good. Ms. Martinez, would you like any soaps used on your face? Okay, I'm going to start with the eyes. I would place a towel under the head of my patient. If there was a pillow, I would remove it, but if necessary, but she only has one and it's not in the way. I would then soak my towel, wring it out, rub it around my hand. When I get to the eyes, if my patient was unconscious, I would provide eye care. That's any creams, ointments, or anything provided by the healthcare provider, or prescribed by the healthcare provider. I'm going to start with the eyes, working in an outward motion. I would start, go to the ears, the cheeks, under the neck. If my patient was a male, I would offer any shaving, if necessary. I would dry her off, ensuring she's still comfortable throughout the procedure. How are you feeling, Ms. Martinez?
Good.
Okay, I'm going to remove this towel because I don't have another one for the video. I would then work my way to her arms, placing an absorption pad under her arm. I would soak my patient's fingers 3 to 5 minutes if necessary, providing any nail care, clippings, trimmings, anything like that. Once again, soak my towel, wring it out, place it in a mitten formation around my hand. Once I do the fingernails, I am going to work my way up towards her elbow and then to the axillary. Once I'm there, I'm going to place my patient's arm above her head if tolerable, still going towards the axillary in long motion strokes. I would then provide any care for my patient, deodorant, or if they needed to be shaved. Since they're done, I'm going to dry her off. Once again, I'm going to be using the same linen just because I don't have another one, but I would discard this in the linen thing. I would then place her arm under her sheet. I'm going to do her chest and abdomen and pelvic area next. I would then place a towel under there. Since my patient is a female, I want to be sure to move her breast with the top of my hand, not cupping it. Once again, soaking the towel, draining it, and wrapping it around my hand in a mitten formation. Starting here at the top of the abdomen, under the breast, making sure I move it. My patient is comfortable, ensuring their privacy. Working my way to the abdomen, and once I get to the pelvic area, I want to ensure my patient's privacy. If there was a male, I would provide any perineal care. If they were not circumcised, I would pull the skin back, wash it gently with soap and water, let it dry for 30 seconds. And since we're done there, I'm going to dry my patient off. And if they would like to put a gown on, or just up to their preference, or we could just wait until the bed bath. Once again, I would discard of that linen. I would use a different towel, but I don't have one, so I'm going to use the same one. We're going to work our way to the legs, tucking the bed bath sheet underneath and high at the pelvic area. Again, placing an absorption pad. I would soak my patient's feet up to 10 minutes. I would never soak a diabetic patient's feet. I'm looking for any lesions, abrasions when I'm doing the legs because my patient is immobile. I want to check for any swelling. Once again, soaking it, wringing it out, putting it in a mitten formation. I'm going to start with the feet, working my way up to the pelvic area in long strokes. Once I am done there, I will dry her off, provide any lotions for her feet, apply any socks, anything necessary or comfortable for my patient. I would do the same thing on the other side, but since we're on a couch, I can't get to the other side, so if I did, I would raise the bed rails, go to the other side, lower the bed rails, and that'd be the side that my patient's IV was on, so I'd be sure to be careful around it, making sure it's not pulled or still intact, making sure there's no discharge from it. But once I'm done with the other side, I would change gloves, but I don't have another pair, so we're gonna keep these on. So I would change gloves and change the water of my patient. Once I change the water, 2/3, make sure it's okay for my patient. Good. Okay, Ms. Martinez, we're gonna roll you to your side now. Helping my patient turn, ensuring their privacy. I would then place an absorption pad under her back. When I do the back and the sacral area, I'm looking for any lesions, abrasions, and I want to check for any pressure ulcers. She would be naked, she wouldn't have a shirt on. So I'm going to do the back and go in long strokes. Once I get to her buttocks, I want to inspect for any fecal matter. If there was any, I'd wipe it with a disinfectant wipe or wipey. Apply any ointment after I'm done. When I do the buttocks, I want to be sure to go to front to back. Just making sure my patient is comfortable and getting clean all the way. Once again, like I said, I would apply any ointment if the patient had any, but they don't. So we are done there. I would then roll them over, Ms. Martinez, help her get dressed again. Lower the bed, lock, and put the call light next to her. I would dispose of my gloves properly in the container. I would get rid of all my supplies. I want to make sure that I document my patient's experience. If there was anything changing in the skin, I want to document it and how my patient handled the bed bath. I would lower, lock, call light, ensure my patient's okay. If they needed anything else, I would also provide any oral care or offer a back massage if necessary. So that is the end of my complete bed bath. If I did a partial bed bath, if I did a partial bed bath, I would again assess their tolerance level to it and how my patient is able to do it and their ability to do it on their own. I would get the packages and warm them up following the directions of the packages. Once again, don gloves, help them get them in a comfortable level, and my patient can do the bed bath the partial bed bath by themselves, just to make sure they don't need any hygiene care, any oral care, anything. I would then lower them, place the call light, lock and lower the bed rails. I would also document the partial bed bath and how my patient tolerated it. I think that is everything